Aging, of course, is going to have effects on the skeletal system. As you get older, or as anyone gets older, their bone matrix decreases, and this can lead to brittle bones. You're losing that inorganic strength, and so you can end up with brittle bones. Usually the spongy bone is affected first. The bone mass will also decrease as a person ages. Your bone mass is usually highest at the age of 30 years. So it's really important to take care of your skeletal system even after 30 and as you get older, especially as the life expectancy increases. Bone loss increases tenfold after menopause for women. That is a pretty big change. So it's really important to continually stimulate that skeletal system and the bone remodeling. We generally see an increase in bone fractures as people get older as well. Bone loss can cause deformity, that stooped posture that you see in a lot of elderly people, the loss of teeth where they have to get implants or false teeth. That stooped posture, of course, you can see a loss of height. There can also be an increase in pain and stiffness with this bone loss. The last thing we're going to talk about is fractures of bones and their repair. Basically, a couple of clinical things to think about. Orthopedics is a branch of medicine that works to prevent or correct disorders of the bones, joints, and muscles, and their relationship on how they're moving bones. Stress fractures are breaks that are caused by abnormal trauma to a bone. So, for example, in a fall, sometimes you can get a stress fracture from even standing on your feet for too long. That's abnormal trauma. Pathological fracture is a break in a bone or that is due to the weakness of the bone from a disease. So if you have osteoporosis or a bone cancer, that can weaken the bone so that a stress fracture would normally occur. Then with that weakened bone, then it's actually going to break the bone in this case. Fractures can also be classified in a bone based on structural characteristics. So if the fracture line is in a certain direction, then it can be categorized based on that. Here in the top left, we see a non-displaced fracture line. In the top right, we see a displaced one. You can see where that fracture line is completely displaced at an angle there. You can have fractures that are cracked fractures or in many pieces. So you can get a comminuted fracture, so it's in multiple pieces, or a green stick fracture, which is where it's cracked there. Fractures generally are left to heal, and they can heal pretty well if they're uncomplicated, if they're pretty straightforward. They can heal in about 8 to 12 weeks. The more complex the fracture, the longer it takes to heal. The stages of healing that fractures go through, first there's something called a hematoma formation. It's a blood clot that is actually going to start being converted into a tissue known as granulation tissue. And this happens as more and more blood capillaries and cells enter into the area to help heal the tissue. Then you get what is known as a soft callus formation. This is where collagen begins to be deposited in the area, which is why it's a soft callus. And then fibrocartilage is going to convert the granulation tissue into something called a soft callus. Then you have a hard callus formation, and sorry about that, that should say hard, not heart. This is a D. Hard callus formation. And this is when osteoblasts come in and they're going to put in a temporary bony collar to unite those broken pieces while the ossification is going to occur to that tissue region in between. And then finally, you've got the bone remodeling, where the bone fragments are removed by the osteoclast, but the osteoblasts are going to deposit spongy bone and convert it to compact bone to basically rebind where the break occurred or the fracture. And that brings us to the end of our skeletal system.